I just talk from the standpoint of a wholehearted family. Wholehearted means that no matter what the nature of our family, we are wholeheartedly committed, passionate about what we're doing, purposeful in why we're bringing children into our family, into our home, whether they're foster children outside of our family or within our own family, oftentimes redefining family. But from the standpoint of you are so fully committed to what you're doing and embracing children in your home. And our goal in doing that ultimately is we want our children, our nieces, our nephews, cousins, grandchildren, we want them to thrive. We are here to support their thriving in spite of whatever challenges they've been dealing with in their home, for whatever the reasons that they've been removed from the home or a family member has said, I need you to take them, and they've done it voluntarily. Either way, there's obviously been adversity and adverse childhood events that have them in your home. What your job is or your goal is, your commitment wholeheartedly is, I'm taking them in because in spite of that, I'm here to help them thrive now and thrive when they move into adulthood. What we're working toward anytime we're raising our own children or our extended family children, our goal is to raise them to be adults who are able to live lives in well-being. And Dr. Seligman, Martin Seligman, who's the father of positive psychology, came up with an acronym called PERMA. These are the 5 areas that have us living in well-being as adults. These are the skills that we're teaching children so that when they grow up, they can be successful in these 5 areas. The first one, the P being positive emotion, which really is range of emotion, that we're bringing up children who learn to identify emotions. They learn how to regulate those emotions. They learn how to label them and understand triggers for their emotions. It's the ability to access and identify the whole range of emotions, including the positive end. And children with a lot of adverse events oftentimes only see things through the eyes of negative, what's not possible. You know, we can all access anger and frustration, hopelessness, kind of on the low end of the more negative emotions or what we identify as negative emotions, depressed thoughts and feelings, to the other end, which is joy and love and gratitude, positive anticipation. We want them to be able to access that whole range, not just the negative side. And then engagement. Engagement are adults and children for their age and stage who are able to participate in positive activities that they get reward from. That can be things like our faith communities. We're part of a community. The faith is important to us, whatever it is, but it's also being part of a community that we feel like we belong. We're seen by other people. The community that we live in at large, that we are engaged in it in different ways, that we feel part of it. We feel seen by it as opposed to marginalized by it. And that we do find activities that we can do that make us feel good. I always use the example, I'm an avid cyclist. Needless to say, I love cycling. I get reward out of the cycling, but the other reward I get is I'm part of a cycling team. I'm part of a cycling community. It's outside of my work, outside of my family. I get reward. I get along with other people. We're kind of kindred spirits and the kind of people we are that cycle. That sense of belonging, that's very rewarding to me. We often look at children. Are they having activities that make them feel rewarded so that they're learning that for adulthood? Getting reward out of relationships, oftentimes a real struggle for kids with lots of adverse events because relationships are a struggle for them, or the management of emotion has them struggle in relationships. Intimate relationships when we become adults, our relationships with children, if we have them, we have connection with friends, that we have positive relationships if we work in the work field. But relationships are rewarding to us, and that we have a sense of meaning and purpose in our life, that what we do in the world, how we're being seen by the world is contributing to the world. If you have foster family in your home, you have meaning and purpose by the very reason you do that. Meaning and purpose existentially, maybe spiritually, and in service. And that you feel seen by other people as contributing. And then that certainly links to a sense of accomplishment. We want children to grow up and feel like they are accomplished. They are able to create and fulfill the goals that they have for themselves. Our goal is to raise children who can be in rewarding relationship to emotions and in engagement in relationships. The number one predictor for success in adulthood, success defined by well-being, creating the life that you want to create, success being determined by these things as it's meaningful to the person, that they would rate themselves as living in well-being. Number one predictor is self-control or regulation, self-regulation, emotional management, emotional regulation, because you can't be successful in any of those areas if you can't regulate yourself. And so we really do a lot of focus in working with children who've had a lot of trauma and chaos. The number one symptom that they have tends to be dysregulation emotionally or physically. And we really work on that because that's going to become the barrier that will have them grow into adulthood and not be successful from a well-being standpoint. So the challenge of raising children to have fulfilling, rewarding lives and thriving is the word we like to use. The challenge, of course, is that they have had a lot of adverse childhood events, ACEs, we refer to them. They have had trauma, abuse, and neglect. And I always add to that chaos. Chaos is a profound aspect of this. Some kids are never physically abused or sexually abused. We can identify that. We know what that is. And no, they haven't had that, or yes, they have. Neglect is harder to define. Sometimes we minimize it. Well, they were never abused, but they were neglected. Neglect has a profound effect on brain development, and chaos has a profound effect on brain development and detachment as well. So I like to make a point of really including that when we talk about adverse events. An event is traumatic if it's extremely upsetting and at least temporarily overwhelms our internal resources. On a continuum, are we not all dealing with trauma today in this pandemic and how it's impacting us? Obviously, some families are way more impacted by the pandemic than others. Young parents with young kids at home trying to do online learning and work from home. Some families that have to work outside the home, but they have their children being at home instead of at school. Loss of employment. Some families that have been impacted by COVID itself. Families with the least internal or external resources and who are most impacted and susceptible to getting COVID obviously are going to be more impacted than some other families. But to some degree, this whole situation is extremely upsetting to us and at least temporarily overwhelms us. And by overwhelm, we mean that I have this sense of intolerable feelings, stress that's intolerable, dissonance that's intolerable, worry that's pervasive and intolerable, at least temporarily. So that would be acute. And then, of course, when we're experiencing that in a chronic way, that's going to have an even more impact. Sometimes we don't realize certain things are really traumatic because they're not chronic. The brain of a child will become exactly what it was exposed to, is a core principle to understanding the impact of trauma. We don't have to be neuroscientists to understand when we're born with a lot of capacity in our brain. And one of the capacities that we have, of course, is the capacity for language development. We aren't born talking. So we understand that when we're born, we get a repeated experience over and over in a patterned way in a particular language that we're exposed to. With that repetition and pattern and language, that activates neural pathways in that part of the brain for language, and we grow up learning language very quickly. Whatever language we're exposed to is the language we're going to learn. We're not going to be exposed to English and learn Spanish unless we're exposed to Spanish as well. And phenomenally, children can be exposed at the same time to 2 or 3 languages and learn all 3. That's just amazing to me because that part of the brain, the neural pathways, are being activated. Now, we all understand that, but we forget that that is no less true for any other part of the brain. And we forget that it's social and emotional part of the brain as well. What we're exposed to is what we develop. What we don't get exposed to, which oftentimes children who live in chronic situations don't get exposed to some of what they need to develop that part of the brain. And if they've been exposed to violence, violence is going to feel familiar to them, or they're going to create adaptive ways to feel safe in a violent situation. Always the beautiful answer who asks the beautiful question. A lot of times we come up with quick answers to things, but we haven't really asked the right question. And when it comes to trauma, abuse, and neglect, the right question to ask is not what's wrong with you. When children show up in our home, even family, to a grandparent that they know well maybe, or not so well, because they haven't lived close to that grandparent or aunt or uncle. But even if they do, they are going to come in with disruptive behaviors because they're trying to control the environment to feel safe. And they've learned a way to do that that has worked in the home they came from, but probably isn't going to work in the home they're coming to. So it kind of looks like, what's wrong with you? I told you that if you did that, this was going to happen. But when they did that, they weren't thinking about consequence. They were just being reactive. The better question is what's happened to you. If I understand what's happened to you, then I can more appropriately think about how to plan and predict my response to behaviors, how to plan and predict what it is you need based on what's happened to you, because that's going to be very different than for other children in my home. And so we really need to ask that question. The good is those things we do with our kids that are positive and engaging. The bad is when we sometimes aren't attuned. You know, the proverbial when you're on the phone, that's when they want your attention. Nowadays, it's a lot when you're on Facebook or on the screen and they want your attention and you're not giving it to them. It isn't just that they're being demanding, they're wanting to connect, or we have a bad moment and we kind of bite the child's head off. You know, we're impatient. And it's then, of course, the ugly that is without reparation. When you think about that child and equivalent experiences that are repetitive with a parent who's not able to give consistent responses and attuned responses, you experience the ugly, as he calls it, over and over where there's not reparation. You can see where that leads to a lot of attachment disruption. And worse yet, when that child is actually abused by the parent they're supposed to be safe with. Children who grow up with multiple chronic adverse events as adults have 7 out of 10 of the leading causes of death. They end up with a 3 times higher risk for cancer and heart disease, and they can have a 20-year shorter life expectancy. It impacts our hormonal system, our immune system. So that's what makes us more vulnerable to some of those high-risk behaviors, and certainly to addictions that also cause a lot of high risks. Addictions of alcohol, substance, any kind of substance use are going to put you at higher risk for cancer, heart disease, compromised immune systems. But it does have a profound effect. I like to tell it through the story of Amy and Tommy. Amy is a child who's on the 1 to 3 end of the spectrum of adverse childhood events. She basically got everything she needed for healthy development and healthy attachment development, keeping in mind that attachment and brain development go hand in hand. The more secure and uninterrupted the attachment is, the more the brain is developed appropriate to the age and stage, just as it should be developing. The more disruption there is or insecure attachment there is, the more impact there's going to be on brain development. Amy got everything she needed. The words I love to use are pattern, predictable, repetitive, and attuned. There wasn't any substance abuse while her mom was pregnant. There weren't any chronic high-level stress going on when her mom was pregnant. And when Amy was born, she had two primary caregivers, extended family, and mom and dad were able to provide predictable pattern, repetitive, and attuned caregiving. Whenever Amy cried out, they responded in a consistent way. They attuned to, is this a diaper cry? Is this a hunger cry? Is it a sensory cry? You're there in a consistent way. You keep showing up. No matter how tired you are, you're still able to manage your regulation and emotional regulation to show up, be consistent, be attuned, not show up sometimes, or sometimes be nurturing and other times shake the baby. Amy got that. As she got a little older into the toddler stage, the routines and rituals that we create for children, nap times, bedtimes, eating times, story time, when our bedtime routines where we do the bath time and the jammy time and the story time, all patterned, predictable, ritual and routine. And Amy got that in a very consistent way until she showed up to kindergarten at 5 years old. We're going to see a brain map of her. During that time, she was not abused, she was not neglected, and she did not have disrupted attachment. Then there's children in the 4 to say 6 or 7 category who get pretty much everything they need like Amy, but may have had some acute situations of some chaos going on or a short-term disruption with some reparation to it, or an incident of abuse that certainly will have an impact, but not quite the same way as when it's chronic and she didn't get what she needed for brain development. That's the child that may have some struggle, but more resiliency than the child like Tommy in the 7 to 10 category with multiple childhood adverse events by already age 5. When his mom was expecting him, she was living with his father, who was very domestically violent. That was a chronic stress. And they were living kind of couch surfing, so to speak, month to month, sometimes even week to week. So there was chronic stress where mom was releasing the stress hormone cortisol into her own body and brain. But when women are pregnant, the brain of the fetus also absorbs that cortisol. So just that alone will have them be born different. And of course, mom was using meth until she was at least 6 months. She says she stopped then, but he was born addicted. And you can imagine that in that situation, nothing was predictable, pattern, repetitive, and attuned. Mom left that dad with his sister, who was a year old, by another relationship, and I was living in a southern state in the country, left the dad to get respite and get away from that, fortunately, on one hand. But sadly, she came back to live with her dad, who was her childhood physical, emotional, and sexual abuser. And as all too often happens, she continued to meet up with other abusive and drug-using men. So he witnessed a lot of domestic violence in the next few years. He was the recipient of violence and witnessed his 1-year older sister being sexually abused and subsequent younger sister being sexually abused. That in and of itself is sexual abuse, even witnessing it, but he had all the characteristics we think he may have been overtly abused himself. Needless to say, he's very high on the continuum. When he was about 4.5, he was removed from the home. Mom and the current boyfriend were incarcerated long-term, and parental rights were terminated. The good in this story, as sad as and tragic as that is, the foster family that he was placed with, he stayed with, it was only one foster family. They were very skilled. They had him in therapy with a therapist trained by Bruce Perry, and he began to get predictable, pattern, repetitive, and attuned caregiving, and ultimately they adopted he and the younger sister. The older sister could not make it in that placement. and was placed outside the home. So that's their story. And again, the children that you're bringing into your home or that you know about, that you're advocating for, all of us are on that spectrum. When we work with them from a clinical standpoint, we try to assess where on that spectrum they are and what's the likelihood that impact has been. And very quickly, Dr. Bruce Perry from the Child Trauma Academy developed a brain map in his neurosequential model of therapeutics. And Dr. Perry's probably one of the top 5 people, even internationally, in the field of interpersonal neuropsychology, who has really taught us so much about what the impact of trauma, abuse, and neglect is on brain development. And as you can see in this chart here, it's a brain map that I did of 2 different children. One child, just like Amy, she would be about 5 years old. The top one is a chart of Amy. The brain develops from the bottom up, so this upside down pyramid. On the top, the bottom is dark green. That's the brain stem. That's exactly fully developed, is the dark green. For a child 5 years old, that's what it should look like. This brain map, by the way, definitely replicates an MRI. So if we did an MRI on Amy, her MRI, that part of the brain would look fully developed. The middle part of the brain, the diencephalon, and the limbic part of the brain isn't fully developed because it wouldn't be until she's about 10 years old, but it's just what it should be for a 5-year-old. Each one of those squares represents the part of the brain that controls. So the lower part are all the physiological parts of us that tells us to breathe, tells our heart rate to work. All the lower sensory integration and physiological regulation is in that lower brainstem and the lower middle part of the brain. And then there's the part of the brain that's social and emotional, getting experience of empathy and attunement or not. And so each of those parts of the brain have to get experience to be developed. If they don't get the experience, that part of the brain doesn't develop. But you can see the middle part of our brain for a 5-year-old is getting developed. The light yellow, the last part of the brain to be developed, is the frontal cortex. I always joke about, I don't know what God was thinking. The top part of our brain, the front cortex, is our problem-solving part of the brain. It's our cause and effect part of the brain, where I can think about, if I do this, then this will happen. And yet God gave us cars and hormones 3-4 years before that part of the brain gets fully developed. But it is the last part to be developed. Now, as you can see, it's precursor. It doesn't mean that it doesn't exist for Amy. It means that it's there. That's when we parent our kids. We keep talking to them about how to manage their emotions, because it's the upper part of the brain that helps us manage the lower part of our brain. It's the upper part of our brain that we keep giving experiences to kids. I hear my daughter-in-law say to my almost 5-year-old granddaughter, Ava, make good choices. If you do that, what will happen? If you do that, how will Owen feel? Her younger brother. Those questions that start to just give her experiences to think, what will happen if I do that? Or to problem solve. Well, let's think about that. So we keep giving them experiences over and over that ultimately do develop that part of the brain. This is the brain map of a child, exactly what it should be for about 5 years old. By the time she's about 20, that should be all darker green. The lower one is Tommy. As you can see, the lower part of the brain, even the brain stem by 5 years old is not fully developed. Now, I did this map on the real Tommy, and I did it when I was doing a 3-year training with Dr. Perry. So I had to present this as part of my training to the guru. And I redid it twice because I couldn't believe it was this bad. Finally, I did present it to Dr. Perry, and he did say the story that I told him, and I didn't give you all the details, is one of the worst stories he's heard in terms of multiple adverse events and high end. He's probably a 9 or a 10 on that continuum. If you did an MRI, the gaps in brain development would be the same. You can see that even that middle part of the brain, underdeveloped for a 5-year-old. Now, sadly, those 2 children are showing up to kindergarten being expected as 5-year-olds to function like a 5-year-old. Tommy's being expected to function in the same way little Amy is going to be. He's being expected in these 4 areas of brain development: sensory integration and self-regulation. That has to do with all of our physiological sensory capacity, our ability to manage ourselves physiologically for a 5-year-old, emotionally for a 5-year-old, to be able to do the same thing the other kids in that class are doing because he's a 5-year-old. The relational part of the brain, the ability to pick up for a 5-year-old, social cues. And then the cognitive is the more related to the upper part of the brain. Our self-regulation and our emotional, relational regulation have to be in place for us to be in the upper part of our brain and in a learning state. This is kind of like putting about a 2.5-year-old in a kindergarten class and expecting them to function. When you bring a child into your home that's high on the continuum, you're expecting that 8-year-old to function like an 8-year-old, but very likely in this bar graph, they are probably significantly behind, 2 to 3 years, depending on the level of disrupted attachment, abuse, and neglect. Let's pretend that Tommy is more like a 5 to 7 on that continuum. Raise that left bar is Tommy. The blue is Tommy, the pink is her. She's just a normal average child. This isn't intelligence. This is just part of the brain being developed. She's just a healthy average child, and he's at half the capacity in every area. But let's pretend that he's on the continuum of a 5 to 7. Raise that blue bar kind of halfway up more. That's still a significant disparity that child is trying to function with compared to other kids in the class, like Amy. And without intervention, that disparity is going to go with them the rest of their lives if we don't understand what it is they need. They are going to be the children who will be disruptive. They are going to be the children that can't manage their emotions. They're going to be the children that won't be regulated enough to be focused and have the attention span they need to sit in circle or to learn. Or when by the time they get into 5th grade, you can see what that trajectory is going to look like in terms of failure in school and in terms of getting more and more excluded socially by other kids because they're the kind of child that nobody wants to be around because they're very disruptive. Keeping that in mind, this is a big piece that we forget in our culture that's at the heart of disparity. And keeping in mind those people in prison, oftentimes, most often, are high on that continuum. Children like Tommy are most often functioning in the middle part of their brain. They are hypervigilant to emotional danger, emotional threat, and certainly hypervigilant to physical threat. They are always scanning the world, whether they're in a classroom or they come to your home. On a continuum of 1 to 10, 1 to 3 is when we're calm and regulated. 9 to 10 is when we're in terror and we go to the bottom part of our brain. The more regulated we are, the more calm we are, the more our neural pathways are in the upper part of our brain. And the more triggered we are emotionally or with physical threat, the more we're going to be in the middle and lower part of our brain and go into fight or flight. So Tommy's always kind of sitting in the middle part of his brain. We can all relate to this story. Somebody who used to work with us, she had a new infant, a toddler, and a 5-year-old that was autistic, very challenging behaviors. And her husband was a truck driver. So she was home alone without a lot of help for 2 weeks because her husband was on the road. So you can imagine an infant, a toddler, and an autistic 5-year-old, what that's like being home alone. Needless to say, when she was anticipating him coming home that day, adult companionship, adult needs being met, help, adult conversation, she's really anticipating his being home. But when he walked in the door, he took one look at the living room and said to her, "What the hell have you been doing for 2 weeks? Look at this place." Now you can imagine when she came to the door, she was in the upper part of our brain in positive anticipation. When he said to her, What have you been doing for 2 weeks? Look at this place. She, as we often refer to it, flipped her lid. She went into the middle part of our brain, which is completely emotionally reactive. Let's just imagine we would not expect her to be reasonable. What kind of stupid person would say something to a mother who's been home alone for 2 weeks like that, right? You can imagine how triggered she was. Tommy is always sitting ready to be triggered, just like that mom, because of his experiences. Now, there was no reasoning with her. As she put it, it's a lucky thing there wasn't a gun in the house, because if there was, her children's father would be dead and she'd be in prison. There was no reasoning. Now, the flip side of that story is her husband. He's trying to say, I didn't mean it that way. I'm sorry. Do you think she's going to listen to him? No. Now, when she calmed down and the neural pathways went back up and she could listen to reason, when he said, I didn't mean it that way, I actually was triggered and went in my emotional part of the brain because, as you know, I was raised by an alcoholic mother who was bipolar. Our house was chronically in a state of nothing but chaos. And the worse the chaos looked, the worse the situation got. He was just triggered himself. Now, she could hear that then, and she could process that, and they could kind of problem solve around that. But the point to that story is your children coming into the home are constantly on the verge of an emotional meltdown. And trying to reason with them during that meltdown or giving them a threat when you can see the meltdown is coming. If you don't stop doing such and such, this is what's going to happen. They can't hear that because they're in the middle of the reactive part of the brain. And so we have to do things differently. Common triggers are unpredictability, transitions. If they're coming in your home, it's unpredictable. It's a transition for them. You look at this list and every day they go to class, you cannot go to school in the best of schools, in the most structured classroom, and not face unpredictability. What other kids are going to do, what the teacher may not even be there that day, feeling vulnerable socially to rejection. You can't walk in and be in control of that classroom. Children like Tommy are very lonely because they're starting to feel failure. They feel a lot of shame around their failure. They feel vulnerable to people's judgment because of their family experience. They are that child that are constantly going to be reactive to sensory overload and emotional states. So going to school for them is always going to be a trigger all day long. And that's what we need to help teachers understand and advocate for children. It's hard for an Amy to go to school and deal with that stress, but she can manage it because most of the day she's in the upper part of her brain because she's living a life of predictable pattern, repetitive ritual and routine. She shows up to school in a regulated state. So the stressors that she faces, she can manage. And when she gets home, she might be tired from it, but she can regulate. He is in the middle part of the brain and shows up to all this. And of course, that's the student that's going to be disruptive, not be able to stay in their seat at the very least, and or have meltdowns in the classroom. And then, of course, get a lot of negative feedback and get excluded from the class. Needless to say, he's not in a learning state. So they stay on that trajectory of failure and exclusion set. One of the things that we need to understand is for children like Tommy, what their internal working model is. Basically, what's their core belief about the world? How does the world see them? How do they see the world? Do they see conditional belonging? Are they insecure? I have to be a certain way in order to be loved and belong. Or do they feel secure belonging? I'm worthy of love. I don't have to change for people. People love me for who I am or not. They also look at the world through vulnerability or resilience. Children like Amy, looking on the resilience side, they believe that they matter to the people around them, to teachers. I belong. I'm wanted here in this classroom. I'm wanted and loved in this family. I feel secure attachment. I am worthy. I'm always hopeful about things. I have an ability to manage myself. I know that my emotions and my thinking is not out of control. I trust the motivations of other people. I have no reason not to because I haven't been violated. And I'm open to other people. Kids like Tommy, of course, looking at the vulnerable side, their internal belief, even in my own family, I don't believe I matter or that I'm really wanted here, that people care about me. I'm not worthy. I don't belong here. They are very closed off because you're just one more person that's going to reject me. You don't really want me here. You say you care about me, but my experience is you really don't. And when I get too disruptive, you're going to send me away. We just look at what's the internal belief of this child, and that's what we're working with. If we understand that, then we just want to keep giving them messages that you do matter, you do belong here, no matter what. And we just have to keep giving them reassurance over reassurance. And oftentimes when people bring in children to a foster care, whether it's their own family member or somebody outside, is we think that just showing them the love we have and the caring that we have for the next few weeks, they're just going to settle right in and they're going to trust and they're going to belong and they're going to be secure. And then we feel really helpless a few weeks or months later when they're not, because it takes a lot of repetition for them to learn and trust a message other than I don't belong here. So our goal is to keep giving them messages of I see you, you matter, and you belong over and over in every way we can. We want to build self-regulation for them because that's the number one thing they lack in being able to fit into your home or be able to fit in their school and classroom. Regulation, regulation, and regulation, their regulation, our regulation, and our co-regulation. We're always working on that because kids like Tommy really can trigger us as adults. They're very disruptive. They will say things that they know will push your buttons. They're testing you. I remember the very first training years ago I went to on attachment disorders. The woman started it with, here's what you need to know about children with attachment disorders. Their core belief is adults are stupid and they need to be controlled. And trust me, they're going to control you until they learn that they don't need to as a way to adapt in the world. So they are very triggering children to their teachers and certainly to us. There is an ARC model that's about attachment, regulation, and competency. When we work with students, this is a trauma treatment model, but it's actually a model for healthy development for everybody. The four bottom ones are what children need for healthy attachment development, and that goes along with brain development. Caregiver affect management. More often than not, kids that you're working with, their caregivers did not have good affect management because of being taken over by substance abuse or because of mental health issues. We look at what their experience with their caregiver was. When we work with the caregivers, we look at what their experience was. What's their ability to attune and empathize, their ability to be consistent response, their ability to create routines and rituals. We assess the families that we work with, the parents, and what was their experience growing up. What's their capacity to give that to their children now? And the child that we work with, what's been their experience with a caregiver's affect management, with a caregiver's attunement and consistent response? Where there's been gaps in that, that's where we target our treatment. Going back to Tommy, in redoing his brain map 3 years later, his bar was significantly raised. It wasn't equal to Amy's, but in 3 years, because he got what he needed in these attachment experiences, was more trusting, was more regulated, his bar significantly came up. So the really good is even the parents that we work with in our Thriving Kids program, which is for parents who've been involved in child protective services. Our core belief, our wholehearted belief is they love their children, they want their children, and they want to do right by their children. But there's a gap between that better intention and their ability to do that. Why is that gap? Is it mental health issues, substance abuse, and or histories of abuse? The tragedy is there is that gap, that they're not able to do better. The optimism is that gap is able to be bridged. And that's the goal of our work. The middle three boxes are the self-regulation. We teach how to identify emotions, how to modulate those emotions, and how to express those emotions, because that's where brain development is most profoundly affected, that they're not able to do that, even into adulthood. But they can certainly learn it in adulthood. Young children that are in foster care, when we're doing treatment with them or we're working with their foster family, helping them understand this is what we're targeting. Because once they get the regulation, then they can manage themselves emotionally. They develop and use the executive part of their brain. They develop healthy sense of identity, and ultimately they integrate their trauma, and or all of us, we need all of this for healthy development. We take it step by step. It's really hard. These kids are really challenging. We oftentimes want it to happen sooner than it will, but step by step, it will happen. Our goal is to build resiliency in our children, and that's by helping them feel connected. Connection is feeling seen, that they matter and they belong. That's what you're providing for them in the consistency that you're doing, in the wholehearted family that you're creating for them. I'm seen, I matter, and I belong. We do that with empathy and structure and the continuity, and then optimism. And again, I really emphasize that optimism is not being Pollyanna and overlooking what the challenges and barriers. Yes, these children have been through a lot. Yes, we see the barriers. No doubt we see the behaviors that are challenging, what sometimes feels kind of hopeless about being able to do enough about it. But optimism is, I see that, but I absolutely believe that I can make a positive impact. They need to see that optimism, and you need to hold it for them. And you need to feel optimistic. And we foster that in the work that we do with our families, that yes, you can make an impact. It will be slow, it will take time, but you are enough, you're doing well enough, and you will make a profound impact on this child's trajectory. When we're working with our kids and we're living with them and they get emotionally reactive, logic will not calm them down, but empathy will. All of us know that feeling when somebody gets us, sees us, reflects something to us that's, yes, that's what it feels like. You see me. Empathize first, regulate first, get them calmed down. Then, if you need to talk about what would have been a better thing to do, or there may need to be a consequence, but you don't offer the consequence or try to get them to do the consequence until they're calmed down and regulated. Empathy, get them regulated, then deal with the issue. Otherwise, you're just going to have even more of a meltdown. The resiliency factors, caring, stable relationships. That's what foster families are providing. Therapists provide that, foster families provide that, other relationships can provide that. But when you've been living in a lot of disruption or a lot of chaos or abuse, relationships are hard to form or trust, but the more that they can be in it and the continuity of that, that will become a resiliency factor. Clear, consistent, predictable structures, but I'm going to add with some flexibility, because over rigidity of that is going to cause a lot of reactivity on their part. What needs to be clear and predictable, and then where do we need to be flexible? It isn't about them controlling us. Talking to them about stories. As a therapist, I oftentimes would work with kids and I would say, you know, I used to work with a child whose mom and dad went through a divorce too, and they told me that. And then I would kind of lay out what some of the struggle was for that child, what the feelings were for that child that I worked with. And then this is the way that they resolved it. Or ultimately, mom and dad kind of got their conflicts resolved, and then it got better for them. But I always would tell what the adversity was, what the child in my story felt and was dealing with, and then how they found a way to be resilient. Even in our homes, telling stories about things that other kids have overcome, or just a story that you know that gives them a sense of being able to work it through. Acknowledging what it is that they are experiencing and dealing with. That need to be seen is so profound for what I'm experiencing. and an opportunity to help others. That's especially true for adults. That makes us more resilient. Dr. Perry says there is no more effective neurobiological intervention than a safe relationship. I think that's a profound statement, and I'm adding it to the end. When we're being foster family, that's exactly what you're doing. Remember, children become exactly what they're exposed to. When you become, on an ongoing way, a safe relationship, you are literally changing the neurobiology of their brain because you're giving them experiences in their brain for safe relationship, for empathy, for ritual and routine, consistent response, emotional management. You are doing therapy just like we do. You are being brain changers because the experience they're getting with you literally is changing their brain. That's why he says it's a neurobiological intervention. You are being that intervention. It doesn't take being a licensed therapist to be that. You are being that for them. Make no mistake about it, the profound effect you are having on them, even in their brain development. And you're giving them the message over and over that they are loved and lovable, and they will learn that from how you treat them and how you treat yourself. You know, there's a lot of days, I'm sure, that foster families, and we tell them this over and over, it is so hard, and it feels like we're not making a difference, or I can't do enough to make a difference, or I'm not being good enough as a foster parent. Or as the family member, I'm not doing it well enough. This will never make an impact. Those discouraging days. But we always encourage families to, here's how we can support you because this is really hard. And we're optimistic, and here's why we feel optimistic. And we try to promote that optimism for them. And to remind them, you are being enough. You are being good enough as that foster parent. And as Brene Brown says, sometimes the bravest and most important thing you can do is just show up. Whenever we're facing something bigger than ourselves, it just takes the courage to day in and day out, just show up. And over time, we make a difference. So trust that you're making that difference.